me the difference between that and scalp micropigmentation.
The technique's quite different in the sense that with SMP, we have our needles at full length for the majority of work,
Okay.
and we control depth by hand pressure. With trichopigmentation, you actually preset your needle length down to how deep you want to go, and then you actually put a lot more pressure on the skin. So you actually push the needle into the skin with a lot more force.
Really?
And
No, it's just above the blood barrier, isn't it? Right?
well, it's up in the papillary area of the dermis, so the upper levels of the dermis. So it's just below the basement membrane between the dermis and the dermis. Sorry. So they actually push it in, and you also do the impressions a lot closer together each session. And so I found that you get a lot more blowouts, you get, a lot more migration under the skin, and too, because the pigment's totally different consistency, it's different chemicals in there. And it's only semi-permanent, only lasts maybe 18 months if you're lucky. And then because of the type of pigment using, because it's got a lot of undertone pigments in it, it will leave a different colour in the skin. So you might end up with red dots or purple dots, depending on what the undertone is of the pigment.
No kidding.
So there's a lot more colour theory involved with it, because a lot of the PMU pigments might have a green base or a blue base, or more of a red base, or that's how you get your undertones coming through.
That is so interesting to me. Just the difference between the two. So is it still considered like a 5 o'clock shadow type procedure in a way?
Absolutely. Yeah, and there's some fantastic artists around the world doing it. It is starting to come back to being a little bit more, I believe, because a lot of the pigments have changed anyway from when I first started. So the pigments are a lot better with their undertones and things like that. It's totally different once again. There's a lady in Italy, Milani Lardi, who is amazing at trichopigmentation. So, and there's some definite, times when you should use it rather than SMP. Like, for alopecia areata, trichopigmentation is probably a much better solution than SMP is, you know what I mean? So, but you have to know colour theory.
You can do both, right?
Yeah, I can do, but I don't.
Oh, you don't? So, because
very rarely.
Based on what you said, so you believe that sometimes that they should have trichopigmentation over SMP. Have you ever suggested that to somebody, like often, or how do you go about that if you can tell that they need one or the other?
Well, it depends on what sort of hair loss it is, and what their end expectations are and what they want to achieve. So for things like alopecia areata, which quite possibly, in most cases, the hair's going to grow back.
Yeah.
Depending on, because it can go to universalis or one of the other ones, but, if you can see that there's white fluffy hairs in those bald patches, that means the hair's going to come back and it's growing back. So if you did SMP in there, when the hair grows back through, they're going to have dark patches now because you've got SMP plus the hair under the skin. So this way, if you just use a permanent one and it fades out to nothing, then once the hair grows back, it'll look normal. So
Right. Okay. That's super interesting to me.